Hi, thank you for clicking on my link today. Welcome to Gary's little corner of information. The other day, I posted a video about my own experience of developing some early stages of dementia. Uh, and today, I want to talk about taking care of a family member who actually has dementia. A lot of family members end up being the actual caretakers of these people until they eventually cannot take care of them any longer. So, one of the things you really need to do, you need the patient with dementia needs compassion, patience, an uh, organized approach. And here's some of the strategies to help you manage. First, you need to educate yourself. You need to understand dementia. You need to learn about the different stages and types of dementia. And this will help you anticipate changes and prepare for future needs. You need to stay informed with the latest research and treatment options because those are changing constantly. After my 20 years in healthcare, working as a nurse practitioner, I saw a lot of things change. So there's always hope in the future for better treatments. And so one of the things you need to do for your family member is create a safe environment. Okay. And so you want to remove any kind of hazards, eliminate tripping hazards, like throw rugs, for example. You can install grab bars by their toilet or inside the shower. And you want to ensure that there's good lighting all the way throughout the house. Label things, label doors and rooms to help the person with dementia navigate their environment better. And very important is you want to establish a routine. You want consistency. You want a regular schedule that can provide stability and reduce confusion. Uh, you want to break complicated tasks down to simple steps. Simplify those daily activities. It'll really help the person with dementia. Uh, you need to look for non-verbal cues. So you need to pay attention to their body language and their facial expressions to give you an idea of what they're feeling. Please promote independence as much as possible. Allow the person to do as much as they can for themselves. Adapt activities so you can modify activities to match their abilities and their interests. You can manage some of the behavioral changes that are going on. And so the way you can do that is you personally have to stay calm. And when you respond to the agitation that the person may be showing and give them some reassurance that you need to adapt, redirect their attention if they're misbehaving somehow. Mm, And so use distraction techniques to manage the difficult behaviors. And the one thing you need to do is help support their health. So regular checkups, ensure they make it to the medical appointments and follow the treatment plans that have been laid out, providing them with a healthy diet, provide nutritious meals, and encourage physical activity. But most important, one of the things that are really important is you need to take care of yourself as a caregiver. You need to seek support, join a caregiver support group, and share your experience and learn from others who are in the same situation. There is respite care in a lot of communities, so you could arrange for regular breaks for yourself to avoid burnout. Self care is very important for the caretaker. Make time to for your own health and your own well-being. And what you need to do is you need to plan for the future with the person that has dementia because there's issues with legal and financial planning. They may have not written anything out on paper for the future. So consult with legal and financial advisors to arrange to manage affairs for the person with dementia. Utilize all the resources you can in your community, community service. Look for those resources like adult daycare centers and respite care center services. And professional help may end up being needed. You may have to consider hiring professional caregivers uh, for additional support. Remember, every person with dementia is different, and what works for one may not work for another. Stay flexible and patient, and seek help when they need it. I will put a link to my video about living with dementia on this page as well. So thank you for listening, and you have a good night. And take care of yourself.